welcoming you to our Smilo Shares. This is the second installment of the Smilo Shares series celebrating the cancer survivors during the month of June. So we'll go around to do some introductions. I'm Anca Bulgaru, medical oncologist with Smilo Cancer Hospital in Waterford. So Scott, can you hear us?
Sorry about that. I dropped off for a second there. What did I miss? Did everybody go around and introduce themselves already?
Would you mind to introduce yourself?
Sure. Sorry that I disappeared there for a second. So I'm Scott Capoza. I'm a physical therapist for Yale New Haven Hospital. I specialize in oncology, physical therapy. I'm one of the first board certified clinical specialists in oncology in the country. And I also have had the honor of working in the Smilo Survivorship Clinic since its inception in 2006. So I wear several hats throughout Yale and throughout Smilo. And I'm happy to be here tonight. And with that, I'm going to introduce Lynn.
And I'm Lynne Balsmo. I'm a psychologist in pediatric oncology at Yale. And I've been there for about 13 years now. And I work with the younger half of the AYAs, but as well as working in our survivorship clinic. So see people grow well into adulthood.
I'm Tanya Glenn. I'm the third-year Reproductive Endocrinology and Fertility Fellow. So we work with adolescents all the way up through menopause, but I'll specifically be talking today about fertility preservation in the setting of cancer.
Thank you all for being here. And I could start by opening the conversation and addressing some of the specific challenges that the young cancer survivors face, and also talk about what help we have available and what resources we have available throughout the Smilo network and beyond. Patients aged 15 to 39 constitute the adolescent and adult and young adult population, and they represent less than 2% of all cancer diagnoses. And we are fortunate to say that due to advances in treatments, more than 80% of these patients would become long-term survivors. We all know that cancer care doesn't stop when the treatment ends. And actually, many patients report that they face new challenges when the safety net of so many frequent medical checkups and seems to disappear, and also maybe the support of family and friends thins out. And but it is important to acknowledge that what these challenges are, and because we do know that knowledge conquers cancer. So it is important for the young cancer survivors to identify and be aware and know how to identify and manage late effects and long-term effects associated with cancer treatment. Long-term effects are represented by the side effects from the treatment they receive. They may persist after the treatment ends, whereas the late effects are those that could occur even years later. So they can affect different organs. It could be cardiac complications, endocrinopathy with thyroid or problems, or diabetes problems, fertility, and so on. We do know that we have to keep a keen eye and identify or diagnose early secondary malignancies that could be associated with the cancer treatment, or even with a hereditary predisposition that could have led to the first cancer diagnosis to start with. We are encouraging people to prevent and stop risky behaviors. We do know that young adults are who are cancer survivors are more at risk for such behaviors, such as smoking or excessive alcohol, and promote healthy lifestyle. And if we go to the next slide. the American Institute for Cancer Research came up with guidelines in what it means to have a healthy lifestyle that could prevent cancer, and also promotes health for cancer survivors. And those include to be of a healthy weight, to be physically active, exercise at least 150 minutes moderate intense activity a week, eat less sugar, less processed food, less red meat, limit alcohol intake, and do not use supplements for cancer prevention. And for patients who conceive, consider breastfeeding. Next slide. There are some particular issues that the young cancer survivors could face. And Dr. Glenn will talk more about fertility preservation. We also want to mention the risk of sexual dysfunction associated with cancer treatment, either from surgery, from early menopause, or radiation therapy. And I would like to mention that we have a sexuality, intimacy, and menopause clinic available through Smilo Cancer Hospital to address specifically the sexual dysfunctions and intimacy issues that cancer survivors may face. It is important to acknowledge that many cancer diagnosis at such a young age could have hereditary predisposition, even in the absence of a family history. On the other hand, not every single cancer diagnosis is due to hereditary predisposition, but it is important to talk to your doctor about finding out if you're eligible for genetic counseling and testing, because it has implications for screening for other malignancies, but also for the risk stratification for the family members. So cancer survivors could deal with many physical issues that are related to the side effects of the treatment, but also with the physical scars and sometimes deformities that are left after the treatment. And those are such critical issues for young adults who, because of the body image and the importance of that for their self-image and confidence. And it impacts relationships and the quality of life in general. There is a big role for the physical rehabilitation, and Scott will talk more about that and how important that is to mitigate some of these issues. The psychosocial impact of cancer diagnosis will be addressed by Dr. Balsamo, and we do note that patients face a high degree of post-traumatic stress. They have to deal with the fear of recurrence, and I would like to draw attention that the next Smilo Shares next week will be dedicated specifically with coping with the fear of recurrence. So young adults are going through developmental milestones. They are supposed to be focusing on achieving an education, getting employment, and all of a sudden they have to add to that the distress of a cancer diagnosis and its consequences. So there could be many implications, and as I said, we'll hear more about that. And we do have resources from the social workers and also the financial counselors who could advise us on that. Next slide. It takes a team to care for a cancer survivor, and we try to individualize the care to the specific needs of each survivor, and to identify if there is need for a referral to behavioral health, to a psychotherapist, to rehabilitation, to counselors. And I'd like to emphasize the importance of having a primary care physician. I know that many young adults tend not to do so, but it is very important that the primary care is involved, and that there is ongoing communication with the oncologist. We encourage survivors to have a formal survivorship consultation with our clinic, where all these needs can be identified and also addressed. I also encourage people to take ownership of their care, know the treatments that were administered, medications, so then the medical providers could identify potential late effects and address them early. Knowledge is power, and we do know that that young adults like to be online and on social media. So on the next slide, I actually show the homepage for cancer.net, which is the internet page for the American Society of Clinical Oncology, that has many links for support groups and other resources, as well as links for scholarship, college scholarship, and financial support. And with that, I pass the baton to Scott. Thank you.
Scott, you're muted.
It would help if I unmuted myself. Thank you very much. Yes, so I was just saying, thank you, Doctor, for teeing up the rest of us so nicely with that presentation. So in oncology rehab, especially for our young adult population, you know, I'm seeing a variety of different diagnoses through, for a variety of different diagnoses. I'm seeing younger and younger women with breast cancer. I do see some individuals who have gone through testicular cancer, and I definitely have seen some folks who have gone through hematologic cancers. And so, from a functional standpoint, I want to be able to look at these people who are coming into me, and I want to say, well, what's going on with them? But beyond that, I want to know, how is this affecting their lives, on a day-to-day basis? And so as a physical therapist, with all of our training in the musculoskeletal system, and then the additional training that we've had, specific to oncology, we're able to kind of help meet these needs. And that's the thing that we want to focus on the most, is that all of these concerns that people come in with, whether it's a loss of strength, or it's a loss of range of motion, or it's just overall being deconditioned, right? You were going to the gym with your friends, and all of a sudden now you don't feel like you've got the energy to go to the gym anymore. Or you enjoyed hiking, or you've got a 1-year-old and a 3-year-old at home, and you want to be able to play with them, and you just don't have the energy to do that anymore. So again, what does that lead to? That leads to, a decrease in function and overall a decreased quality of life. So that's our role as physical therapists, to help increase and improve your quality of life. So this is a very big and kind of scary graph that came out in 2019 that really gave us as physical therapists a little bit more guidance when it came to in working with individuals with a history of cancer. And again, we want to be working with people to say, we want you to try to go out and exercise, we want you to try to do strength training. But this gave us a little bit clearer definition as to how we can kind of specialize our interventions based on how folks are presenting to us. And so it's our job as PTs to be able, and as rehab professionals, to take this big scary graph and boil it down and make it personalized to you. So if you've ever actually wondered, because I know you're staying up at night wondering to yourselves, what does oncology rehab actually look like? That it looks like a variety of different things. We're putting together a structured, individualized exercise program, and I know that it can be very very tempting to go online and try to look up the first YouTube channel that you find that's, if you put in there, cancer exercise, but you don't necessarily know the qualifications of that person who's got this YouTube channel, or, just because they've got a lot of likes or a lot of followers, that doesn't necessarily mean that what they're doing is based in research. So, we as rehab professionals, everything that we do is based in evidence-based practice. And so we're going to be able to take you through a structured exercise program. And one of the things that you can't get from a YouTube video is that you can't get the hands-on manual techniques that you might need to help advance your range of motion, to help with scar tissue management and that sort of thing, or to be able to, assess how's your skin looking after radiation. So we need to be able to get our hands on you and to be able to help assess that. And then also, balance is such a big concern for so many of our folks that undergo chemotherapy. There are particular chemotherapy drugs that we know can cause peripheral neuropathy. And if you can't feel your feet, you're a falls risk. And if you're 30 years old and all you want to do is go for a hike, or even if you're just walking down the streets of New Haven, and the streets of New Haven are not great with correct sidewalk and everything, I don't want you to be a falls risk. So we're going to walk on balance, and you want somebody there keeping an eye on you and be able to progress you through a program. So that is what oncology rehab looks like. And I'm also going to put my email address at the end. We're all going to put our email addresses at the end, but in the short term, we do have oncology rehab in a couple different locations in New Haven, the New proper area. But if you're in different areas of the state, if you're more down in the Bridgeport area with Bridgeport Hospital, if you're up more in the Lawrence Memorial area, we definitely have oncology rehab staff, both PTs and OTs, that are trained in oncology rehab and are trained in lymphedema services, if you need that specific service as well. And with that, I'm going to turn it over to Dr. Glenn.
Hey, good evening, everyone. I'm Tanya. All right, so we're going to discuss today cancer and fertility. Next slide. Can you advance the slide? Sure. So whenever that I see patients, usually the first question I'm asked is, well, how is this going to affect me? And, what's my fertility look like? And unfortunately, it really has to be individualized. It depends on multiple factors, especially age, type of, and duration of treatment. And I always say everyone's different. You could have the same chemotherapy or radiation therapy as a person next to you and respond completely different. We do know that certain things are at higher risk to lead to infertility or having problems having children in the future, such as pelvic radiation, radiation to the brain, and chemotherapy with alkylating agents are just a few. However, with any chemotherapy, usually we recommend fertility preservation, given the fact that even someone who has a potentially low risk chemotherapy could still have adverse reactions and have, again, a lead to infertility or infertility at an earlier age than another individual. So there's a lot of different ways we can preserve fertility. There are a few ways that we recommend because they have the best information out there, like sperm freezing, egg freezing, or embryo freezing, which is when the sperm and the egg come together. So if people have a long-term partner and they want to freeze what a fertilized egg would be, we would do embryo freezing. We also now can do ovarian tissue cryopreservation. What that means is literally doing a procedure where we take a piece of the ovary and freeze it, and can later put that back into the body whenever you're ready to have children. We can also do, if you have pelvic radiation, we can do just simple shielding, and we can also pull the ovaries up and kind of out of that radiation zone as well. Next slide. So of course, this is really hard for anyone undergoing, it's a lot to have to talk about, having a cancer diagnosis, but then the last thing you want to think about is your future fertility as well. So sometimes better ways to get information too, again, Dr. Google is not the best, is Oncofertility Consortium is one of the websites I love the most. It has an area specifically for patients. It actually has fertility preservation options and helps you walk through them. It also has a patient navigator where you can talk to someone. And it has a lot of community resources. So it can look at what can, the Oncofertility Consortium is based out of Illinois, but it can say, what do we have here in Connecticut? On that website as well is something called Save My Fertility. And again, it has more patient information and patient handouts. It's hard when you're having the discussion with a doctor to remember absolutely everything. And so this is a really good way to say, like, I didn't understand that. Let me look at it again. Next slide. So after the first question of what does this mean to me, the next one is, can I afford this? And unfortunately, financial assistance is really depending on states. Luckily, Connecticut does have a law that says that Connecticut-based insurance that is private has to cover fertility preservation. However, if your insurance is based out of Wisconsin, Massachusetts, Maryland, New York, it's all very different. Therefore, usually we have patients come in, we'll talk to them when we put it through insurance so we can give you better ideas. However, patients with something like Medicaid have no insurance coverage, but there are places out there that can help us get medications covered or at least reduced, or have scholarships for the IVF cycle. Some of these are Win Fertility, Fertility Within Reach, Live Strong. And then also, of course, once you have these embryos, eggs, sperm, we need to store them somewhere. And a lot of places when you store are several $100, $600+ per year. However, Reprotect, which is Vernus Perch, has greatly discounted prices specifically for cancer patients. And then also medications can run $5,000, and Walgreens Heartbeat is a really good way to help cover that. Next slide. So just wrapping up, our main office is in the 200 West Campus Drive. It's right off of 95. Scheduling can be found at this number. We do need referrals, so that can be placed by any of your physicians. We usually get them from oncologists, but of course I've gotten ones from primary care doctors, OBGYNs, anyone. Appointments can be telehealth or in person, especially for that first visit. So we can kind of talk about your options and what the impact of your cancer treatment will be or has been. All right, I look forward to questions.
All right, so I'm going to wrap up the PowerPoint part of our presentation. And I'm hoping everyone can hear me. Yes, okay. So it is obviously never a good time to get cancer, but the reason we're particularly concerned about mental health of AYAs is that the already difficult cancer diagnosis intersects with the timing of so many developmentally normative tasks, including establishing future goals, your sexual identity, body image, separating from parents, etc. 30 to 40% of AYAs will report a negative impact on education and employment. And as we just heard, there are negative impacts of cancer on sexual intimacy, sexual function, plans for having children. AYAs report significantly worse physical and mental health as compared to the general population, and unmet emotional and psychological needs are reported as major concerns post-treatment. So there's one message, if there's one message I want to convey tonight, it's be kind to yourself. Don't judge or evaluate what you feel. There's no right or only way to feel. Accept without judgment what you're going to experience, the range of emotions you're going to have. We're often our own worst critic. And sometimes it's helpful to ask yourself, what would I tell my friend if they were going through this experience? Your answer is probably going to be far more compassionate and patient than the one you're giving yourself. So be kind to yourself. Less stress and more social support are associated with psychological growth. The literature tells us that. So learning ways to reduce your stress and maintaining social connections with friends, family, or a support group will improve your chances of coming away from this experience with something positive. So some other quick tips for mental wellness: follow your healthcare recommendations. Keeping yourself physically healthy is obviously an important component to mental health. Learn healthy coping and practice what works for you. So it might be exercise, it might be spending time with your dog, meditating, spending time with a friend. If it reduces your stress, do it regularly. Being flexible is super important. If nothing else, cancer teaches you to go with the flow, right? So be open to change. And this, I think, relates particularly to that next point, which is allowing yourself some time to fully resume school or work activity. And I'll keep talking until it comes back. But anyway, so having goals obviously is important, right? But allowing yourself some extra time to get there is also important. We work with a lot of, young adults, college age individuals who, are insistent that they're going to go back and take a full course load, or take a full course while undergoing treatment. And while we try to support them, you don't also want to set yourself up for more stress, right? So allow yourself to go back at your own pace. It's pretty common for those who are not immersed in the cancer field, right, to think you're done with treatment, well, everything should go back to normal. So try to manage that pressure from others. Maybe take the time to have a gentle conversation with a loved one, that it takes a little bit of time to get back to normal. So when to ask for help. Be proactive. I guess that's the other biggest point, right? If you think you need it or you want it, get some help. In the pediatric program, we're really excited to be bringing in an evidence-based program that teaches patients close to the time of diagnosis adaptive coping with stress to improve resilience. And so we're teaching strategies for wellness before difficulties are encountered. So there's no harm in seeking help early, with the idea that learning those strategies and skills can be really positive for mental health. The questions I would ask myself, or you should ask yourself, wondering should I go see a therapist or some other mental health provider, is my mood interfering with functioning, right? So if it's interfering with my ability to do things that I want or need to do, would I like to feel better, right? Am I in distress? And then finally, can I control my worry, right? If you can't control your worry, it's usually a signal to get some help. So affirmative answers to any of these questions are an indication to get some assistance. So who to ask for help. This is kind of a generic sort of slide, but if you are still in treatment and have your hospital social worker or oncologist, they're a great resource. They will direct you to where to go. And if you're not, go to your primary care provider. They're also would be quite able to refer you or set you in the right direction. You can obtain a list of providers who accept your insurance. Certainly, if you think you might benefit from a medication consultation, you would seek out an MD, but a psychologist, social worker. Anyone with those credentials would be appropriate people to seek out for mental health support. And then I would suggest that you consider a provider who specializes in cognitive behavioral therapy, CBT, only because it's a real evidence-based type of therapy. It has been shown and demonstrated to reduce anxiety and depression and stress-related symptoms as well. And then lastly, just some general resources, which I will admit I pulled from Connecticut Children's Medical Center because they did a lovely job of putting together this list of resources. And as I kind of was poking through them and looking, I was really impressed actually by the number of webinars and informational sessions that are on these with mental health, as regarding mental health, but also other aspects of survivorship care. There's lots of ways to meet people and support groups at in-person and virtual meetups, which again speaks to that piece of maintaining social support as a protective factor for mental health. And I think that might be it. This is our conclude with our contact information.
So thank you all for your talk. I
Great.
would like to answer one of the questions in the chat. Someone asked if a referral is needed for a survivorship consultation, and the answer is yes. Your provider can enter referral in the computer system or send a referral. And although the flagship program is in New Haven and Guilford, we do have survivorship programs in different stages of development at all Smilo cancer centers. And those could be the entry point to the larger network. So talk to your oncologist about that, but also the primary care could help with that.
Yeah, and I would second that. We are actually also taking self-referrals. Every so often somebody will refer themselves, and so yeah, while getting a referral from one of your oncology providers, any of your oncology providers is great. Every so often, people will call the number and they will touch base with Kiki, who is our admin for the survivorship program out of Yale New Haven, Smilo New Haven, and we can get you set up that way as well. So, and yeah, and I know Lynn, you're involved, with the pediatric clinic, and so, but we, the adult clinic, we will see anybody, from the age of 21 on up.
And I'll add, if you've been diagnosed with cancer under the age of 21, it would be the Heroes Clinic. It doesn't have to be, but it can be the Heroes Clinic, and you don't need a referral for that. It's just a matter of contacting our nurse coordinator, whose number and name I know, but number I don't have offhand, but certainly I can get that to people if they want it.
So we encourage the attendees, the participants, to enter questions in the chat. And while we are waiting for some of the questions, I have a question for Dr. Glenn. Could you talk about the issues of many patients fear treatment delay that could be like a barrier in getting fertility preservation or making. So,
yeah. No, and we see a lot of patients who in the hospital who sometimes need something, absolutely immediately. I still love to see those patients because then they're kind of plugged in, they know who we are, and we can just follow up them afterwards. Some patients, of course, especially with acute leukemia and different things, require chemotherapy and their surgery or their, treatment immediately, and they're not strong enough or healthy enough to undergo what we need for, preserving eggs, or doing a surgery or preserving sperm. And so usually in that case, we have them undergo their cancer treatment, and we can follow up 3 to 6 months later too. And usually we want to, if we were going to do something like egg, sperm, we probably would wait closer to the 6 months afterwards. If we're preserving ovarian tissue, usually it's about 3 months afterwards, or a lot of times it's, if they're doing multiple cycles, we'll do as close to the next cycle as possible. But I have a lot of breast cancer patients actually who do are diagnosed, we get them in, we rush them through, and it takes for what's IVF, which is egg or embryo cryopreservation, it takes about 2 weeks. And so a lot of my breast cancer patients, they can wait 2 weeks and they're healthy enough and strong enough at that time too. That's not a problem. It's usually the patients I see in-house where we talk about the options, but we know we have to wait for their therapy. And we know that might take a hit on their fertility, but getting them as soon as they're better is better than waiting, years down the line when their fertility just continues to decline. And so I always say, there's no harm in coming and talking to us. We can reach out. We do a lot of telemedicine now, especially after COVID. And that's usually the best way. So we can talk about the options, we can get some labs, we can get you your best advice. And then we can always have you plug back into us afterwards. Or if we're able to, do something in the meantime, we can talk about that too. So I always say, never be afraid that, it's too late or too early. It's not always the right time to talk.
Thank you. We do have a question, and maybe Dr. Balsamo could address. How do you deal with possible issues of employment discrimination when you have to justify the period of absence in your CV? I know that there are some legal implications there. There's the fear of stigmatization, but what are some of the strategies?
I'm not sure I'm equipped to answer that question certainly from a legal standpoint. I would welcome anyone else here who has any sort of thoughts on that, but I think that's out of the scope of my competency.
Well, I think that's the psychological impact. How do you navigate that?
So in terms of I think you have to be, well, I'm unclear a little bit to the question. So, in terms of the stigma of it, or certainly I think you have to be sort of straightforward. Nothing comes of, not being as honest and as straightforward about why there's that gap, right? There's certainly no shame in having cancer or taking time off to take care of yourself. And I think any good employer should sort of appreciate that. But beyond that, I'm not sure that, seeking an attorney probably would be helpful if you feel like there is a level of discrimination. And certainly if you feel like it's causing a lot of stress and anxiety, I guess that's a little more where, getting mental health support is helpful in terms of navigating some of those feelings.
Yeah, and I would, to go off of that, and I think that was actually on that slide, Lynn, that you put on there with all the resources, triage cancer, right? Like that's what they specialize in. They specialize in work related concerns, just like that, especially for the AYA population. So, I think to be able to maybe reach out to the Triage Cancer, go on their website. I am sure that question has been asked before. But yeah, I would agree. I think transparency is always a good policy, if that comes up. But I wouldn't, definitely don't feel ashamed. Like, there's a gap in your resume, and that's just what it is. It is what it is, right? And if you get to the interview point, then it can come up in conversation, or maybe it doesn't. So, but Triage Cancer is probably one of your good resources to go to there.
My take on that is that your medical history is private. So actually you could just say that you had to take time off for some health issues, but you are not necessarily obliged, if you choose not to do so, to give details of your medical history. So I would also like to mention that the Cancer Center paired with a legal firm who provides legal assistance to patients who may face different issues related to employment or all kinds of situations where legal support may be necessary. So maybe that's also a good time to talk about the issue of post-traumatic growth, where yes, indeed, cancer diagnosis is life-altering. It changes everything, at least initially, but a lot of people use this as a way to build resilience, to find a new appreciation for life, and to identify their priorities, and to grow, and getting a new job is definitely part of it. And it's part of the recovery and going back to a normal life, or maybe a better one. So we have some questions about neuropathy and balance effects after chemotherapy, in terms of duration,
Yeah.
and if you want to address them. So
Yeah, I've been kind of going back and forth and checking on those. So I think one of the questions was how late out from completion of treatment can you work on balance that's caused by neuropathy? And I would say it's never a bad time. Ideally, in the first year or two, we might have a little bit better return as far as sensation goes, but it's never a bad time to work on balance. And so, again, just to give you a quick snapshot of what that could potentially look like, if you come in for rehab, we can get you in the parallel bars so that you're safe. And, we can first just start with very simple lower extremity strengthening exercises, working on graded step ups and lunges and that sort of thing. You'd be amazed how much balance you need to perform a lunge. I can talk to you about how to set that up at home as well, so that you can safely practice that. And then to be able to integrate, being able to do some of these activities on uneven surfaces, on like memory foam and that sort of thing, and to be able to do that with shoes on and with shoes off, and to be able to do it with eyes open and with eyes closed. There's a whole progression that we can go through to be able to challenge you. And interestingly enough, I was on a talk earlier today. We talked about cancer and cognition. So I can throw some cognitive questions and tasks at you at the same time. But the short answer is you can come in and work on balance, that's related to neuropathy at any point.
So in terms of how long the neuropathy lasts, that depends on the treatment, on if there are any pre-existing conditions. Unfortunately, we know that neuropathy could be one of the long-term or late effects, and it's very individualized. There is discussion that physical exercise does help with the recovery of neuropathy. There are symptomatic medications that could be used, and talk to your doctor. So we have another question. Is the survivorship clinic only for the survivor, or are the services for the family too, including siblings? And Scott, you want to address that?
I'm sorry, the question was is the survivorship clinic for caregivers as well?
Yes.
So we do, caregivers are definitely welcome to come. At least in our model that we have through the New Haven proper area, caregivers can absolutely sit in on my session, on my physical therapy session, and they can also sit in with our medical consultation, whether that's with our MD or with our physician's assistant. Typically, though, we don't have caregivers sit in when they meet with our social worker, because there's a lot of very confidential questions that can be asked at that time. So that's the model that we have now. But I'm wondering, if the other panelists have any specific resources for the caregiver, because obviously, the needs of the caregivers need to be addressed as well.
Dr. Balsamo, would you want to comment?
I mean, in the pediatric world, and I think the question might have been about siblings as well as caregivers, and certainly in the pediatric world, the patient comes in sort of with the unit of their entire family, parents and siblings, certainly less so with COVID now. But we are both in survivorship care and on care sort of equipped to help the whole family or to address the whole family's needs. And so we certainly try to do that with parents. We have social workers who will work, very closely with the caregiver or the parent, and typically will refer out to a community mental health provider if the needs are great. But certainly I'm available and social workers are available to deal with that. Our siblings, and this isn't so much for our, and then siblings, of course, we also will address their needs through school programs, or again, through our child life specialists will address some needs as well as the social workers and myself. And then in the survivorship program, typically, it depends on the age, right? Adolescents will often come with their parents, their caregivers. Sometimes young adults will come in with their caregivers, mostly because caregivers can still be pretty anxious about their adolescents' cancer experience. And again, the patient is our patient, but we do try to address any concerns or needs. And although I don't have any specific resources per se, we do try to, assess what the needs are and respond to them as needed appropriately.
So I'm referring to one of the questions to mention that although we think of the cancer survivors as those people who completed the treatment and now they are in the smooth sailing phase, there are people who live with cancer and with an uncertain prognosis, and they face their own challenges in terms of the quality of life, the balance between treatments and side effects, and the interference with family life, work, and everything else. They have to make decisions about participating in clinical trials and take a chance on new treatment. And we do strongly encourage participation in clinical trials, but because that's how we make progress in oncology, finding new treatments. And that's what led to such tremendous developments in the cure rate. So we are here to support those patients as well.
Yeah, and just to dovetail off of that, I would encourage that, anybody with a history of cancer, whether you're still in active treatment or you're a long-term survivor, whatever, however you're identifying yourself, there's survivorship clinic, throughout the network, again, whether it's the New Haven area or it's the Lawrence Memorial area or that's the Greenwich Hospital area. We are, our doors are open. We will never turn anybody away. So don't feel that you have to, that you have to be done with treatment and then be done. You can still be on maintenance therapy. You can be on clinical trials, throughout the balance of your life. So the doors are always open.
So we have questions about how to access the previous lecture in the series, and I think links will be available online on the website at a later time, but you could always write back to the organizers to send you the email for the login, and they can send you the link. So I have another question for Tanya, for Dr. Glenn. So we talked about fertility, but could you talk a little bit about the importance of contraception? Because there are patients with who underwent treatment and they were told that they have a low sperm count, for instance, or they may have issues with fertility, and all of a sudden things may change.
Yeah. So especially during or after cancer treatment, even if you're told that, you know, fertility is unlikely, you never know. And so, you know, at REI, we're also the good people because we do a lot of contraception as well as infertility treatment. And so, you know, for contraception can come in a lot of different forms. You know, some individuals are able to take hormonal pills like birth control pills afterwards or during, depending on their treatment. And other people are told not to take anything with hormones. And we have a lot of non-hormonal options too, like intrauterine devices. We have injections. You know, of course, barrier contraception is always an option that you can do at any time. You know, and then also I think someone mentioned too earlier, like the menopause or sexual dysfunction clinic, because the other part with contraception is that sometimes people during, after therapy may no longer feel like having sex or have it is painful. And we can talk about that and we can help address that. But also there's a clinic specifically by Dr. Minkin who looks at that as well. And she's a great resource for us, but you know, we're happy to see anyone as well for about contraception, fertility, or making sure that sex is still enjoyable.
Thank you. So there is a question about college scholarship and financial assistance. Again, if you go on the cancer.net, the American Society of Clinical Oncology website, and look for just the type in the search engine, type there AYA resources, you can get several links for that. And then talk to the social worker in the clinic. They also have a lot of resources. And there was earlier a question about what about patients who don't have a social security number? There are foundations that your social worker can get you in touch with to get some assistance.
And I would add to that too, you know, going back to the question about, you know, the colleges and that sort of thing, the financial aid. The other great resource, which I think was also on that that slide, Lynn, that you found, was the SAM Fund. This was started by a young woman who is a young adult survivor herself from the Boston area. And she realized that, you know, trying to finish college in the middle of a cancer diagnosis is tough, especially when those college loans come due, or to try to get a scholarship to get into college. So so the SAM Fund is another great financial resource, and I can put that in the chat right now.
Someone in the chat asked about the sexuality and intimacy program. I put the number in the chat for both men and women.
These are all great questions.
Dr. Balsamo, what about mindfulness? Could you give people some advice on how to use that, help them cope at different stages during their survivorship or cancer diagnosis?
Yeah, so, you know, mindfulness, meditation, those are all skills that are in the literature would tell us are really great in terms of reducing stress. There are some great apps out there that I think do a great job in teaching things like mindfulness and meditation. I like Headspace, Calm. Those are two ones that you have to pay for, which they're great if you're gonna, I always tell them if you're gonna use it, pay for it, it's great. But there's some free ones like Insight Timer also has some great meditations and can help guide you towards a practice. And it is a practice, like, and it takes a little bit of time, but there is huge benefit in being able to, it's that self-compassion piece that I talked a little bit about, self-compassion and acceptance, and being able to take a deep breath and acknowledge what you're feeling, but not sitting in it and not dwelling in it, like letting it go. And there's a lot of freedom in that. And that is associated with an ability to manage stress better. So if you haven't tried it, I would certainly suggest those apps. There's lots of decent books out there too. It's a very popular idea right now because it works. And I think even if you could do it for a couple of minutes a day to be mindful, which is just sort of being introspective, just kind of, accepting where you are. And that's in an effort to just sort of be non-judgmental, right? To be self-compassionate. And so it does allow you to have a little distance from your feelings too, right? So if you can just sit with it for a second before you act impulsively, that's kind of the other piece to being mindful.
Thank you. Very, very important. So we have a message that I'm going to read out. First, start with thanking to the panelists, but for everyone, don't be afraid to ask questions or ask for help. Even if a provider doesn't have a solution for you, they can point you in the right direction to get help. Everyone I've had the privilege of taking to a Yale Smilo has been really wonderful.
Thank you, Chris. We appreciate the vote of confidence there.
Might be some hesitation to ask questions, especially in a public situation like this webinars, but the Smilo people don't judge and truly want the help. So thank you so much. Thank you for these very nice words. And yes, indeed, we are here all committed to help your journey from sickness to wellness, to a better you. You are the hero of your own cancer story, and we are here to help you write it in the very best possible way. So extend my thanks to all the panelists and also to all the participants, and thank you for being here.
Yeah, thank you everybody for logging on tonight. This has been great. Again, this is the first time we've done this platform to specifically address these needs and concerns, and so hopefully we will keep this going in years to come, because obviously there's a lot of needs, a lot of concerns, and lots of questions out there. So, but yes, we're as a unified Smilo team, we're here to help you all move forward. So yeah, so I know everybody probably needs to get to their dinner, which has probably been sitting on the dinner table for the past hour or so. I know mine has. But yes, and I would say as a parting thought, yeah, please tune in next week. So the same time, 6:30 Eastern, we'll be talking about something again very important to the mental health of anybody with a history of cancer, which is fear of cancer recurrence. And so our survivorship team from New Haven, Smilo proper will be leading that one. So we hope you all will be able to join us for that as well. So thank you, everybody. Have a fantastic night. Be well, and we'll see you again soon.
Thank you.
Bye, everyone.